What are the preparation you should prepare for the health of the pregnancy?
Wow, that's a very good area, because you see, a lot of things in this part of the world were a bit backward. Normally, a woman should not just become pregnant without planning for it. Sometimes when women come to the hospital and we are trying to take histories in the hospital, or we are trying to what I mean by history is we are trying to interrogate them, trying to find out what exactly brought them to the hospital, and trying to make a diagnosis of what is happening. We ask them, and then you'll be surprised that a lot of our women, even though married, have a lot of pregnancies they didn't plan for. A lot of pregnancies they didn't plan for. A lot of pregnancies that are not desired. They don't want it. Many of the pregnancies around are unwanted. So, ideally, a woman of reproductive age should plan for pregnancies. She should not just get pregnant anytime. You should get pregnant when you are mentally, physically, and in all ways ready for the pregnancy. Talking about the health aspect, when we talk about preconceptional care, we want to be sure that this woman who wants to get pregnant, all our system can undo pregnancy. I give you an example. In this part of the world, people can get pregnant too often. Imagine a woman who has already had 5 children. The last child she had is just about 6 months old and she's pregnant again. It means that her body may not, I'm stressing, may not have recovered well and may not be ready for a pregnancy. So that kind of woman can then come down with anemia. Her blood may be short. It may not be enough to handle pregnancy. So she will be coming to the hospital. You may have to be giving her blood. You may have to be giving her higher dose of blood-giving products, which we call hematinics. So that is number one. Number two, how old is she? What is her blood pressure? If she's somebody that has her blood pressure on the high side, we would want to control that blood pressure. She will be on medications that are safe in pregnancy. That's another area I will quickly touch before I stop on this question. We want to, because for example, if somebody is hypertensive, has been taking blood pressure lowering drugs, which are antihypertensives, it's not all antihypertensives that should be used in pregnancy, because they can affect pregnancy. So let's assume that there's a woman who has hypertension and then wants to get pregnant. She should first see her doctor. In that process, they will change her drugs to the one that are compatible with pregnancy, so that it doesn't affect the baby, and ensure that she's well controlled before she gets pregnant. Why? Pregnancy in itself has a tendency to increase our blood pressure depending on the risk the woman is exposed to. There are some women, they only have elevated blood pressure in pregnancy. Outside of pregnancy, they are fine. So you can imagine somebody who's already having hypertension, and then we know that there are certain things pregnancy can do, and then she gets pregnant. To start with, she did not control her blood pressure before she got pregnant. She got pregnant, and then pregnancy becomes blood pressure now becomes very high. And it's at that point you now be thinking, this is not safe for your life. We will now be looking at, is it not better to make you alive than to allow the pregnancy to continue, because it will now become a threat to their life. So every woman who wants to get pregnant first should make up their mind that they are ready for the pregnancy, and then they should plan it. Go to the hospital, have a thorough check, an evaluation of your body, where they would then find out that your body is ready for pregnancy. Again, it is in that period that a woman will start folic acid. Many of our women in this part of the world, they will start folic acid when they have conceived. Some people will have been 5 months into pregnancy before they start. No, because the early time when the body parts of the baby is formed is about the first 8 to 10 weeks of pregnancy. So when you are starting folic acid at 20 weeks, that's 5 months, the deed is done. So basically they should have started so that their body already has enough of the elements, or enough of the vitamins, enough of the body nutrients that the body should have for pregnancy. So I picked folic acid for example. There's something called neural tube defect. That is a baby, maybe neural tube just has to do with the brain to the spinal cord. Some people will have babies without a well-formed head, no head. Some will have a head that is too big. Some will have defects in their spinal cord. All of this can be prevented if a woman has the adequate folic acid in her system before she conceives.